It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that are helping to change people's lives. How about our new digs?
Love it. It looks great. You know what? We're going to kick off the show with our first best doctor, and that is Dr. Robert Marvin, bariatric surgeon, one of the best in the Houston area that helped one individual lose a lot of weight.
Charlie's weight was 380 pounds with a body mass index of 58. So, I mean, he's clearly in the high risk group. In fact, anyone with a body mass index over 50 is considered super obese and has an even higher risk than our average patient would have for developing problems.
My wife and I did a lot of research when I decided to have weight loss surgery. And I chose the sleeve mostly lifestyle reasons.
Really what the operation is based on is changing the stomach into a narrower tube like the esophagus or the small bowel.
The recovery for my surgery, Dr. Marvin tells his patients up to 3 weeks to return to work. So I took the full 3 weeks off. I had the time to take. I probably could return to work after 5-7 days.
In modern society, we just don't need a stomach that we've been provided with. Whether it was evolutionarily necessary to be able to store a lot of material at one time because humans or pre-humans were not eating very often. But with the way our society is now, we simply don't need that much stomach. For some people, that becomes the pitfall. The capacity's there, and it generates the extra hunger that's just not necessary anymore.
You know, it is a complete lifestyle change. The day I came for my very first weigh-in, I weighed 429 pounds. Today I weigh 265.
These operations provide the best chance of curing diabetes there is. People with diabetes generally go and see an endocrinologist who will try to control the blood sugar with medications, but that doesn't make the disease go away. Having a gastric sleeve, or particularly a gastric bypass, the cure rates are high. A gastric bypass, the cure rates for diabetes are probably 80%, 85%, maybe higher than that.
For the sleeve surgery, they say the average patient can expect between 45 and 83% of their excess body weight to disappear, go away forever. I had surgery, day after tomorrow will be 6 months ago, and I've already lost 63.6% of my excess body weight. I sleep much better, I feel much better. You know, I mean, everything's just so much better.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
I started having heavier periods where I would have to, make sure that I was near a restroom, and, kind of got to be about every hour to 2 hours, I would have to check, have excessive bleeding, and so I would not, wear anything that would, have the ability to, show any type of accident, which again is very embarrassing.
It's a very common problem. It affects about 1 in 5 women. A lot of women think they just have to put up with it, and that's part of being female. And sooner or later it will stop. But in fact it goes on for a long time, and it interferes with their work life, their exercise life, their sex life.
And it started getting irregular too. It wouldn't always be every 4 weeks. I mean, sometimes I would have it 3 weeks, sometimes 5 weeks, so I couldn't even anticipate if we were going on a trip or,
Again, in the old days, 10, 15 years ago, it was very common for the gynecologist to say, well, let's just do a hysterectomy. This new minimally invasive technology was developed called endometrial ablation, referring to ablating or removing the lining of the uterus.
And Dr. Leibman gave me the alternatives and said it's a very short procedure. I trust him wholeheartedly. I mean, I've known him for 20 plus years, and I would trust my life with him.
She certainly didn't want to have a hysterectomy. So when we talked about this minimally invasive procedure that involved no cutting, no hormones, she was really interested.
And so came in here, cannot stand needles, cannot stand any procedures. I was in and out of here for sure in an hour. And I mean, obviously I did get put under.
The recovery is very similar. It's going home, taking a nap, having some pain medication, and usually that night there is some cramping, but the following day almost everyone is up and about and doing what they need to do.
And went home, slept for maybe a day off and on, and I was back at work the next day. And ever since then I've been perfect and feel wonderful.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, Pam is here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
One of the best plastic surgeons in the Houston area is Dr. Lucian Ravella, and today he's going to talk to us more about tummy tucks.
Sharon, she's special in the sense that she was having a hysterectomy in addition to a tummy tuck. So she's, again, had children, had some loose skin, and wanted to have that improved, and had the opportunity to do that at the same time as she was having a hysterectomy.
When I first came to see Dr. Ravella, it was when I was about to have another surgery done. I was going to have a hysterectomy done, and it was something that I was very passionate about. I had tried to lose weight and couldn't get rid of the stomach bulge, so I came to see Dr. Ravella and the staff.
Typically it's someone who's finished their childbearing who will come to us for a tummy tuck. And they might have excess skin that overhangs on the bottom of their tummy area, around the belly button and below. They might have some stretch marks. We remove the excess skin, and then by lifting up that skin, we see your whole rectus muscle, which is the solar plexus. And by pulling those together with suture, it can become firm, like to bounce a quarter off of it.
I was completely impressed with how much caring he has for his patients and the staff has. Everybody was very supportive. Each woman had a different recommendation of what made their life easier or what they've seen patients have an easier time with.
She's now several months out, has lost several sizes, and in addition to the result of the surgery creating a improved body contour, it's actually inspired her to lose more weight on her own, so she looks even better.
I definitely feel like I have had a new lease on life, that I did definitely have a jump start. I feel more confident. This was done completely for me. I didn't do it for anybody else. And in my line of work, that definitely helps to be able to go out and speak confidently to individuals. So it has improved my confidence tremendously.
Vitamin D deficiency is a very common problem in America. It's not so much our diet, it's just the lack of a lot of sunshine because we've been taught not to get a lot of sunshine anymore. Vitamin D in your body should be somewhere between the number 30 and 100. Now, if you're real low, you need to get that up. Vitamin D can help you have a better immune system function. Also, it prevents heart attacks and strokes. And there's even some evidence that it helps fight off cancer as well as reducing the rates of Alzheimer's disease. Now, if your vitamin D is low, that is less than 30, you want to get it up into the range of 30 to 100, preferably around 50. Now, for most people who are deficient, that's going to take somewhere between 1,000 to 5,000 international units. But you want to be sure you get vitamin D3, not vitamin D2. Get the cheapest vitamin D3 you can find over the counter. Vitamin D3 is absorbed better and utilized better in the body than vitamin D2. So get vitamin D3 and take enough units to get your number up between 30 and 100. Your physician can measure that number now, put you on the right number of international units, and then check it again in about 3 months and see if you're in the right range. So it's not good to get D's in school, but it's very good to get D's in your diet.
A bunion deformity is a deviation of the first metatarsal and the second metatarsal. So basically, you know, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation. So I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an Austin bunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed, and because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, you know, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then obviously for the females, it's wearing the high heels. You know, it's there's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
I would love to be able to get back out there and be pain-free. A lot of times I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for a longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, you know, that's the rewarding part to me.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
To be a comprehensive breast center, it doesn't mean having a nice building and a nice name on the center. There's a lot of people that have done that. What makes you a comprehensive breast center is working with other physician specialties together to do the best that you can possibly do for each patient. It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are. This is what the beauty is of a comprehensive breast center. So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team. When people come to TOPS Comprehensive Breast Center, or if they come to one of our Memorial Hermann breast centers, what they'll see is a group of dedicated breast radiologists. So when they come to one of our centers, they're dealing with a radiologist who is focused on finding cancer at the early stage. And one of the things that we talk about as a group, we want to disrupt as few lives as possible while finding cancers at their earliest stage. That's our mission statement. If someone comes in and then we have a finding on the mammogram, or they come in with a palpable lump and they need an ultrasound. In many facilities, this is performed by a technologist. The doctor may or may not ever see the patient. If they do see the patient, they only look at the area of interest. It is our policy and our practice that radiologist comes in on every patient. We scan every patient ourselves. Yes, our technologists look,
but we scan every patient. My strong belief is, and I think statistics prove that, is that when you have specialists doing this, you get a better result. In our practice, that's what we do. That's the whole focus of our practice. You know, it's a very special group of people from all over the country, from very well-trained facilities, and so it's an exciting group to be part of.
Don't forget, of course, Candace, for more information on any of the great doctors you see on today's show, head to the website. It's bestdocsnetwork.com. That is the place to go.
It certainly is. And next, we're going to head to our next best doc. It's oral surgeon Dr. Paul Metz.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Dr. Meredith Morgan is one of the best physicians in helping women manage menopause. Practicing for over 35 years, Dr. Morgan, as you see, has a unique office. It's located in the Museum District, a freestanding facility with a relaxed atmosphere. Today's topic, perimenopause.
It's really important to understand that this is a normal process, and it happens with all women. It starts in their mid-40s. The average age of onset is 47, and on average it lasts about 4 years.
According to Dr. Morgan, perimenopause represents a change. Women will experience a number of symptoms.
This is a time of relative estrogen deficiency and brings on mind, mood, memory, and even sleep disorders and irregularities. Yes, there are hot flashes and night sweats that most women think of as menopausal, and yes, they can be just as severe as the postmenopausal ones. But the differentiation between transitioning and a non-cycling constant state is the unpredictability and uncertainty that can be so distressing to a woman.
For women experiencing perimenopause, Dr. Morgan outlines the next step.
We have 3 levels of management. The first will be basically lifestyle adjustments and home remedies. The second is non-hormonal medical prescriptions, and the third is hormonal management. We want to treat at the lowest dose for the shortest duration, consistent with what the need is. We have to understand it's important to use what is acceptable to the woman herself. In my mind, without a doubt, we've taken a step forward for the city of Houston and its surrounding environments. We've developed a site that is comfortable and convenient, that provides medical center quality with minimizing the hassle that's involved. It's been very rewarding to have done this for the last 10 years, and I'm looking forward to the next 10 and 20 years in continuing to do and help women throughout the entire region.
For those out there suffering sinus problems, there is one doctor in the Houston area that can help you breathe a little easier. Ear, nose, and throat doctor, Dr. C.T. Nguyen.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
The reason why I chose breast augmentation was because my breasts were smaller than all my friends. I had the smallest ones, and it was never fun wearing a swimsuit. And
Megan came to us looking for breast augmentation, and it's a surgery that allows her to fill out her clothes, fill out the fashions that are popular, and have more confidence in herself and in her appearance.
When I was trying to figure out the size, I didn't want something that looked fake. I kind of wanted to look natural. And
with the breast augmentation, we'll see someone for an initial consultation, and then after the initial consultation, you'll have a preoperative visit. And the surgery itself, they'll come in that morning, they'll meet with our nurses and our anesthesia staff, and then the surgery itself takes about an hour.
I got the breast augmentation done on Friday, and I returned to work on Tuesday, and I really didn't take the medication as much as I should have, which was fine because the procedure, I healed pretty quickly.
I think in general, the ability to have an operating room in our office allows us to control the entire experience. And so from the second you walk into the office to the second you leave, and they're seeing your 3rd and 6th month follow-ups, the experience is controlled by myself and Dr. Bancroft. The Quad A SF is the gold standard for outpatient ambulatory surgery centers to be credentialed in and accredited by, and so we have voluntarily have gone ahead and gotten certified. Unlike many other surgeons who do it in an unaccredited or non-accredited facility, you just don't know how safe it is to do it there, and they may be very capable or they may not have all the equipment they need.
I feel a lot more confident in myself. I feel better when I wear clothing. It's more fun to put clothing on.
Patient selection is important, and making sure that your ability to deliver results are in line with their expectation. If their expectations and your expectations are aligned, they're extremely pleased with the surgery and being able to do it in the office in a comfortable environment where they're familiar with the office staff. And so as long as you select the proper patients, then patients are very satisfied with breast augmentation or any of the other surgeries we're able to do in our office.
We have an epidemic of diabetes going on in America at this time. Diabetes is high blood sugar. Normally, your blood sugar should be less than 100. We define diabetes as a blood sugar of 126 or higher. If you have a blood sugar of 100 to 125, that's called pre-diabetes. If you don't do something about it at that point, it will develop into diabetes almost for sure. What's bad about having diabetes? Well, it damages every blood vessel in your body. That can result in vision problems, even blindness. It can cause kidney failure and heart attacks or strokes. None of those are good things. To prevent or treat diabetes, the best thing you can do is lose weight. That will help the most. Also, eating an ADA, that's an American Diabetes Association diet, will help. You can find that on the internet at multiple websites. So if you have high blood sugar, exercise, eat right, and things should get better. Remember, sugar is sweet, but you don't want to be too sweet.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
BioLife started with this desire to kind of house or hold all this reconstructive material for our patients, so we only had to do the surgery once. Because you can take stem cells from fat and you can treat that fat and separate those cells out, we then are able to do that and also save those cells for future use.
I was 13 when I was diagnosed with Perry-Romberg syndrome, and ever since then I've had little surgeries here and there.
Angela has Perry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence, and then slowly over time the tissue tends to just wither away.
My first 3 treatments with Dr. Genecov were mainly just building it up, starting from scratch, putting tissue into my face, and then he built on from there with adding the silicone bone to my chin, adding the donor bone to the side of my face, rebuilding my eye socket, my nose.
If we know we're going to operate more than once, we don't want to go back in and have to harvest all that fat every time. So now we have the ability not only to remove the fat and store that fat, but we can also take the enrichments, the stem cells and regenerative cells that exist within that fat, separate them, and then add them back to another aliquot of fat prior to the reintroduction of the grafting process.
He's put tissue and everything to kind of regrowth, and it just makes it so that my appearance is that I'm normal on both sides.
We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. And that's why we developed this. Now it has application outside in orthopedics and cosmetic surgery and ultimately cardiac surgery and just general therapeutic issues. But it was started out for patients like Angela who have severe facial asymmetries who need repetitive operations. We can take that fat, store it, and then process it in such a way that we can better enhance their reconstruction later on. Then everybody's a winner.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that are helping to change people's lives.
And of course, for more information on any of the outstanding physicians you see on today's show, head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, we sure want to hear from you. Send us an email at info@bestdocsnetwork.com.
There you go. So long, everyone. We will see you next week.